Bismillahirrahmanirrahim. Assalamu alaikum, ladies and gentlemen. I am Jahangir Khan Bazai, and I'm the SUSI 2012 alumni, and I'm the moderator for today's PUAN talk, which is around COVID-19. Before I introduce my esteemed speakers for today's PUAN talk, I just want to give a quick fact check about the COVID-19 situation in Pakistan. The cases of COVID-19 started emerging in Pakistan in late January in 2020. And since then, we have 640,988 COVID cases, and so far 40,028 deaths. Right now, we have 37,995 active cases throughout the country, and a breakup of that is that AJK has a 1,166 cases. Balochistan surprisingly have 204 cases only. Gilgit-Baltistan only 16 so far, and Islamabad 6,823. KPK has 3,070. Punjab has 19,320 cases, and Sindh has 4,086 active cases. The positivity ratio countrywide is 10.15. And since I'm talking from Balochistan, the positivity ratio in Balochistan is 4% right now. These are the facts that I got from the government COVID vaccine, COVID website, and throughout, these are the facts that are available for us. So in today's PUAN talk, I have special guests who are expert of the COVID-19 situation, public health experts. They have done a marvelous, excellent job, and all of them are an inspiration for us right now. We have with us the first panelist is Dr. Zaeem. He is a Fulbright alumni, and right now he's the district health officer in Islamabad. We have all seen the amazing work he has done, very inspiring work. And with him, we have Dr. Bhavita Kumari. She has done her MBBS and MPH, and right now she's the PhD candidate in Tulane School of Public Health and Tropical Medicine in New Orleans, USA. And with her, we have Dr. Fareeha Irfan. She is a health policy expert, and she's also a Fulbright alumni. Thank you, everyone, for joining us for today's PUAN talk. My first question will be for Dr. Zaeem. Dr. Zaeem Saab, we have been through a very difficult time from the last 1 year, and now we've seen that the COVID vaccine has finally arrived, and a lot of people has already vaccinated. But still, we see that there are a lot of people are not comfortable with vaccines and the precautions. A lot of people don't like masks. A lot of people don't believe in social distancing. What do you think about this? Dr. Zaeem, can you hear me?
Yes, thank you, Jahangir, for making me part of this amazing panel. And as we all know, that COVID is rampant across the globe, and the current spike is on its way, which what we call the third wave. There are some of the things that we face when we are working on the field. As you said, vaccine is here, and we are actually currently catering for people above 60 and the frontline healthcare workers. So plus 60, and the good part is we have a priority for plus 70 and disability who are above 60. And our teams are like across the country. As far as I'm concerned, we look at the Islamabad strategy. And Islamabad has a good percentage of elderly and the health workers being vaccinated. Jahangir, can you hear me?
Yes, I can hear you. We
Okay.
can hear you clearly.
Okay. So you talked about the myths. There are certain myths out there which we've been working upon, and since we have a political buy-in, we have the administrative buy-in, and all the famous well-known people have gotten the vaccine, and they are coming out there and tweeting about it and mobilizing it socially, and it has helped us a lot to get over those myths and to help people understand that this is the vaccine and which is what we need to get for our elders and the frontline healthcare workers. For a lot of healthcare workers, there we saw a little bit of we saw resistance in the beginning, but as the time goes by, through different channels and through different personalities, we've been talking about the benefits of the vaccine, and now everybody is convinced almost, and it is not as bad as it used to be in the beginning. And a lot of people are walking in above 70, above 60, and we do not see any resistance at this point. And we had registered of 51,000 people and scheduled 39,000 people, and 31,000 people have been vaccinated in Islamabad, which is quite a good number. So our Ministry of National Health Services, National Command and Operations Center, has been focusing on the COVID strategy and how to contain the virus, and also the plan to manage the micro smart lockdowns, and then strategy to vaccinate the elderly. It's been doing pretty well now.
Thank you, Dr. Zaeem. In this time, as you said, there are already 30,000 people vaccinated. How important is the testing? Do you think people should go for tests and should continue doing testings?
Yes, Jahangir, there are three ways that we look at the entire system. If we look at, we call it Islamabad model. Um, we have three ways that we manage to get all the testing done. First, the doctor suggests and the private labs get the test done. And all the positive people are reported to our office, and we contact trace them. And by contact tracing, we mean we go out there at the doorstep, we take the history, look at the risk factors, look at the possibilities that they have contracted the virus, or the history of being in contact with somebody who was positive. Um, and then we test the household as well as in the neighborhood. And this is the first time I think that we have conducted more than 150,000 tests across Islamabad at the doorstep, which is a huge number. And the third one is our lady health workers out there go around and look at in the community. They know what's going on in the households, the survey, and they tell us that this house has a traveler, this house has a contact, this house is a positive, and this person could be possible. And some of them have symptoms. They go to the doorstep and they ask some of the questions related to COVID-19 risk factors. And if they find that there are a lot of risk factors and possibility of virus and symptomatic people, we send our teams to get them tested. And testing is very important. As if we don't test, how would we know that there's a positivity going on? And the positivity really matters when it comes to what is the mechanism or methodology, how you run the test. And is it like focused on one area? But in our case, we have been testing from both urban and rural areas and at the doorstep of people and get them tested. And also, some of them get tested when they visit the hospitals and they have symptoms. Hospitals have their own counters where they give their samples, and the tests are conducted in the National Institute of Health, and the results are again sent to us if they are positive, and then the cycle continues. So we have an amazing network of the private and the public hospitals, all the hospitals working under good coordination. And whenever we have a positive, we have somebody who's symptomatic at home, and we keep a check on the health status of the person who's positive at home. If the symptoms exaggerate from mild to moderate, we send our rapid response teams to evacuate the patient to the hospital and from the hospital back to the home free of cost. And the tests are done free of cost. All those who are going to the private labs do pay the money to get tested though.
Thank you, Dr. Zaeem. We'll come back to you again for more questions. And right now we'll go to Dr. Bhavita Kumari, and I would like to ask her, I being a frontline health worker every day hear these questions from people that they are not comfortable with vaccinating their parents, their children, and their families, because they have heard the vaccine has side effects or reactions, or different kind of stereotypes and myths are attached with these COVID vaccines. What are your thoughts about that? Is there any reactions or side effects of these vaccines that you would like us to know?
So basically, one thing that I would like to clarify at the moment, as you said that they are not comfortable getting vaccinated, their children. So the COVID vaccine is not indicated for below 16
the
years.
Children right now.
Yeah. So this was also one of the misconceptions. Many people are trying to get their children vaccinated too. So one thing we need to clarify that the vaccine has not been approved till now for people under 16. And so talking about elderly, one thing, there was some confusion among the people that the vaccine, some of the vaccines are not indicated for people above 60. The reason for that was not that it was not contraindicated for the people above 60. The reason was that there wasn't enough research to prove that the vaccine was safe in the population amongst above 60. But now that we see that even those vaccination have been inoculated among the population that is like above the 60 population, and the same vaccine has been widely used in Middle East too. So we can safely say that the vaccines are very safe. And about the minor side effects, if your parents, I think parents of young children should know that whenever they go for the regular immunization of their children, after every shot, your newborn or your infant is also having these side effects of fever or shivering, or he's irritated. So these are the similar side effects that we can expect when you get yourself inoculated with a COVID vaccine. Definitely you're inoculating a vaccine, and it is supposed to do something in your body to develop the immunity, so that next time you're infected with the COVID virus, you don't get the disease or you don't get the symptoms. So basically your body is preparing for that, and the side effects that you're getting, you should realize that the body is reacting to the vaccine, and actually the vaccine is working in your body. I will personally talk about my experience. I just got the second dose of the COVID vaccine on Saturday, and for 3 days I was really sick. I mean, I had shivering, but then I got this flu-like symptoms with a very painful ear, which was like, I was myself also got a bit frightened. But then I talked to my doctor, and she was like, "You're perfectly fine. You have flu-like symptoms, which means that your vaccine is working." So I think now that so many people above 60 are being vaccinated, even in Pakistan and most of the world, including the Middle East, which is having similar vaccine brand too. So I believe that it's perfectly safe. And if you have like some minor symptoms, fever, shivering, or even like nasal congestion or fever, flu-like symptoms, you can just go symptomatically, just take painkillers or hot fluids and take some decongestants. That's it.
Thank you, Dr. Bhavita. I can just add into that my father is a 90 years old man, and my mother is also 70. They've been vaccinated last week. They just had a mild fever. Other than that, they are really happy with the vaccination. Dr. Fareeha, someone from the audience, Salman, probably asked that the COVID third wave, he says they've heard that the third wave of COVID is really affecting the young people. How much true is that statement? If Dr. Fareeha can shed some light on that.
I would first like to add a little bit to the answer Bhavita gave regarding vulnerable groups and medics being wary of the vaccine. A Gallup survey conducted among the physicians in Pakistan recently suggested that most of the medics, most of the doctors at least, wanted to be vaccinated. There were some qualms and concerns, but they weren't about the vaccine. Second point that I wanted to add was we spoke about elderly and we spoke about children not getting vaccinated and elderly being safe to get vaccinated. One group that has been ignored so far is the pregnant women. And I really wanted to bring that to light, that pregnant women can get vaccinated. They should get vaccinated for any number of reasons. The side effect profile sometimes is hyped because people are more willing to share bad experiences. So if we get flu-like symptoms after getting the shot, we are likely to tell everyone that, oh my God, my arm hurts and my head hurts and I'm dying. And I would not get the second shot, but the alternative is actually getting very sick. So we need to work on the communication aspect of vaccination. Regarding the question that Salman asked regarding third wave, the idea is that we are all very vulnerable at the moment because we are not vaccinated and we have had a lower rate of infection so far compared to even our neighbors. So that makes us vulnerable. Younger people are more mobile and that makes them more vulnerable further still. So if there is the additional variant, the British variant, that's also making rounds in Pakistan, which has been documented to cause harder disease process. Keeping all these facts in mind, it is possible that the third wave will be harder on the younger people because now, because we are not in any kind of lockdown and we are also looking at a lot of mobility among the young and a lot of carelessness in general around everywhere, literally. And because we are mostly a younger nation, our median age is 22. So a lot of people who are going to get infected are going to be the young ones. And a lot of the people who are going to get really sick are also going to be the young ones. Regarding when will the vaccine be provided to youth? We are trying to get a vaccine for everyone, but even after vaccination, remember that infection will not be prevented. Only the really poor outcomes might be prevented. So the preventive measures like distancing, like wearing a mask, like washing your hands, like not touching your nose, like respiratory hygiene, like ventilation will not go away for at least a couple of years. We will have COVID making rounds and having smaller epidemics around us. So vaccine or no vaccine, those things are not going away anytime soon. We don't know when you will get vaccinated. I don't know when I will get vaccinated. But I know that even with vaccination, I have to be very, very careful. I hope that answered your question. And thank you, Juan, for having me. That should have been my first sentence.
Dr. Fareeha, I would like to ask another question that now that vaccine is around the corner and a lot of health workers and above 60 people are getting vaccinating. People who are vaccinated, they have stopped wearing masks and doing the social distance. do you think it's still important for them to wear a mask? Can they be a carrier of the virus while they are safe and they're immune? Can they still be a carrier of the virus and give virus to other people?
As far as I've understood from literature and from other countries publishing data, it's not just being a carrier that's a concern for people who have been vaccinated. It's very likely that they can get infected. Their likelihood of going to the hospital or getting severe respiratory disease, for example, or dying may reduce, but that does not mean that they will not face any symptoms because of an infection after vaccination. That also means that it's very possible for them to spread the disease among people they live with or they work with or they move around with. So like I said before, the preventive measures are not going away for at least a year or two. We cannot get the whole country vaccinated probably until mid to late next year. The vaccine production speed is not that fast and we are a really big country. We are 220 million plus. The idea that I can carry the virus is, yes, it's very, very possible. It's very, very likely, especially if there is a massive community spread, as we are seeing in Lahore right now. And obviously other big cities too. So yes, likelihood of getting the disease should be a bigger concern for people who are shedding off their masks with or without vaccine. But this false sense of security needs to go away, and people need to be more cognizant of the fact that we are not free of risk, even if we are vaccinated, even if we receive 2 shots even. I hope this answers your question, Jahangir.
Yep, thank you. So that means everyone, we still need to wear a mask even if you're vaccinated for the safety of the other people. Dr. Bhavita, I'm sorry, the pronunciation of your name is difficult for me. I will call you Dr. Kumari directly. We've seen, you talked about the children, and we saw that the symptoms of COVID are very less in the children. I would like to ask a similar kind of question. Can children be the carrier of the virus? Can they transmit virus to other people, especially to the adults?
Yes, they can. Children are often the carriers of the virus. But I would also like to add that it's not always that children are asymptomatic. Children, there have been speculations of severe cases in the children. Even there have been some mortalities too. But then I have personally seen children with COVID diarrhea around me. So it's not that children are always asymptomatic and we should just feel careless about how we protect our children. Definitely they are carriers. Often, the little children around the house, even if the adults are not together, they often cuddle the children at home and everything. And even if the child is COVID positive, you should be careful around that. Yeah. But yeah, unfortunately, we cannot vaccinate them. But definitely they do carry the virus. Hello.
Great, thank you. That means wash their hands, ask them to wear the mask, and also practice the social distancing. Thank you, Dr. Fareeha. Dr. Zaeem, I think we all, people who work in public health sector, we know that the biggest problem that we faced in the early stage of COVID was the health-seeking behavior of the people. They were not ready to adopt the SOPs and everything. Do you think there is any difference that we witness now in the health-seeking behavior of people than the early stages?
Yes, it's a very important concern that I have seen in the beginning when somebody would get diagnosed and our teams go out their doorstep and we would get phone calls to evacuate those people from the even streets. So it was more of a stigma back then. And I think we've been running our communication around strategizing the communication that comes from the Ministry of National Health Services and the communication experts that we have, and how to cater for all those who think COVID-19 is a stigma. And I don't think like the other diseases in the world being stigmatized. And one of the worst things that we can do is to stigmatize something, be it mental health, type of like infectious disease, STDs, or maybe COVID now. So it was in the beginning that a lot of people had concerns, and the concerns would come out in the form of not getting tested, not wanting us to visit them, or maybe not coming out of their homes until they have aggravated or aggravated symptoms. So this created a lot of problems and hurdles for us to get the samples, get them treated, and then the mortality is related to when do you start seeking help. And it's exactly the health-seeking behavior that makes people. So you have a fever, you have body aches, you know that there's something going on, even if it's not. So we say one thing: every chest pain is cardiac until ruled out otherwise. And like this, we ensure that everybody who has symptoms or who has remotely relevant symptoms of COVID-19 or any exposure, and now people come out. I mean, there is least resistance. Our teams would go out there in the field. A lot of people would ask questions like, who are you? Where are you from? What do you want to do? And why do you want to test us? Now people call us and they tell us that, they ask us to get them tested. They want our teams to visit them. So I see there's a decline, and this is more because of the communication strategy we have built around it, and the level of confidence that our teams go out there, the doorstep, and give them is very important. And that's how, if you see a lot of media campaigns been running by the federal ministry and the political leadership and the administrative leadership, and that has helped us a lot. Now we're pretty good.
I have an interesting question for you, Dr. Zaeem. We saw you running and working day and night from the very first day of the COVID-19 till now. How do you keep yourself motivated? Where did you come, like you get all this energy from? I've seen a lot of young people, their energy is a drain. They can't do, and of course you're also young and even maybe younger than me, but where did you bring this energy from?
Yeah, I mean, thank you for bringing this up, because it's very interesting that how our frontline, it's not just us. We probably have quite a few things that keep us going. You remember when it started, and 3 months down the lane, we were like absolutely drained, burned out, and my teams on the front lines wouldn't get a day off. And trust me, we didn't take a day off until now. It's just an ongoing 1 year and 10 months. So 1 year and 1 month straight, no Sundays, no Saturdays, nothing at all. And I think it's about how misery, the miseries that we have seen out there. We do not look at things like, if somebody is calling us or if somebody is trying to reach us, and imagine somebody's relative, mother, father, sister, brother, husband, wife, child is in trouble. So in all this time when a lot of people were getting diagnosed with COVID-19, even the frontliners, luckily, until now, I haven't been diagnosed with some of my frontliners who've been still here. And the willingness and commitment matters, I think, and how you look at the misery of people and how you want to help them. And there's nothing more than that. And if you remember on a media outlet, I had said, if we step back, who would step forward to help those who are sick, who are at risk, who are dying of COVID-19? So that's what gets us going. And energy.
Thank you.
Levels.
You guys have been an inspiration for us. I like, seriously, I think but there cannot be any reward in this world for all the efforts that you guys did. But of course, we have to recognize and acknowledge the efforts that you all did, and all the volunteers, the young people, the frontline health workers. I hope they get the acknowledgement and the recognition that they deserve. Dr. Fareeha, I have a question from you. With COVID, we have seen that sometimes people, their health condition get very complicated. A lot of people, they have fevers for a very long time, and someone just on the Facebook also asked if there is a risk of diabetes and heart attack when you are COVID-19 positive. Can the virus trigger any other disease in the body as well or not?
That's a complicated question. Usually, from what we have learned so far, the virus itself will only bring forward something that's already in existence and has been living, the patient has been going through or suffering from silently until that point. There is no specific evidence regarding triggering of diabetes, which is primarily the disease of pancreas, or insulin resistance, which is type 2. But yes, heart attack and other vascular problems, clots, there has been a higher incidence of those, even in normal population. So yes, if someone has had a history of cardiac disease, the likelihood of them getting a heart attack or what we call the myocardial infarction or angina goes up a little bit. There are these would contribute. If we flip the question, diabetes and cardiac disease, diabetes in particular, would potentially worsen the outcomes of COVID. So two people, identical profiles, except one has diabetes and the other doesn't. The likelihood of the person with diabetes getting sicker than the other is higher. So these are risk factors for worse disease outcomes. And there is a circular relationship in worsening of outcomes in people who had a cardiac problem. I hope this answers the question.
Yes, pretty much. Thank you. Dr. Kumari, a lot of people are careless during the third wave because they think they have already been infected and now they are immune. They don't need to wear a mask. They don't need to take any precaution because they've already been positive and immune. What do you think about this? Can someone contract this virus again and again and again, or it's just for once or twice? Can anybody be immune by getting the virus?
Okay. So it's not clear that whether COVID infections happen or no. It's like the research is still evolving at the moment. For the moment, we can surely say that the antibodies will be there for 90 days once you are infected. So after 90 days, there is a chance of reinfection. The research is definitely evolving. We cannot say anything for confirmatory right now, but still, after 90 days, you are still at the risk. For now, we can say that for sure. So, and even if you are not, even if you have the antibodies, you can still be a carrier. So even when you recover from the disease and you stop wearing the mask, you're bringing the virus home. If you're socializing, if you're going out, you're bringing the virus home, you're still likely to infect the people around you. So right now, everything you do, the masks are like superior to everything. You have to continue wearing your mask for at least 1 year. So you cannot just drop your mask if you are infected previously or if you got vaccinated. You just have to continue wearing mask even if you're infected. Even if you get your vaccination done, that's the priority right now. So yeah, continue doing that.
Great. Also, Dr. Kumari, if someone has symptom, he or she is severely sick, she or he has a flu for a long time, coughs and fever and body ache and everything, but their COVID test is not positive. Do you think there are still chances that the person might be positive?
So if the history is long, I don't think so that the COVID, because if for example somebody said that they had cough for 3 months, so the PCR doesn't stay positive for that long. Like the virus is not active for that long without any symptoms. So if the disease is continued for such a long period, I don't think that it's COVID or actively COVID phase. They should get diagnosed for something else, like check your other blood test, get your probably tuberculosis test done and everything if you have this long of a cough. But you can also get your antibodies checked. Maybe your PCR didn't come positive 3 months back, but your antibodies will come positive if you get your test done after 90 days.
Great. I think I'll share my personal experience that I was severely sick for a very long time, and the first two tests weren't positive, but the third one was after a few days, and I was told by the doctor that my COVID was longer than the other people. I was almost sick, like for 25 to 26 days. Dr. Fareeha, what do you think? You think it's possible to or Dr. Kumari, anyone who wants?
Yeah, I think 26 days is fair, not that long. I was actually reading the question which said 3 months. So 3 months was like, yeah, 26 days, obviously, yeah, you can get PCR positive. As Dr. Zaeem initially said, that the sampling varies and the test result depend on that too. So how your sample was taken, which was the the lab quality and everything also depends on that.
Amazing, amazing. Dr. Fareeha, you would like to add something to that?
Yes, there is a myth that we have been unable to quash for 15 months after the pandemic started, and that is you can get negative test despite having COVID. So if your test comes negative, does not mean that you do not have COVID. It just means that you did not test positive. However, if you get a positive test, then you do have COVID. So that is something that I wanted to add. Additionally, if someone had COVID and they tested negative, but 3 months down the line, they still have cough, like Bhavita said, get antibodies tested. If they have antibodies, it could be possible that they are suffering from long COVID, which damages the lungs to a point where the cough continues for more than 6 months, 3 months to 6 months even. We are at the point where we have enough data to prove that long COVID is a very reasonable possibility, and that is why preventive measures are imperative, because if we do not take preventive measures and we get COVID and test negative, we can face symptoms for a very long time. And those symptoms can be debilitating even. We may not give it to others, but we will suffer ourselves. So yeah, I believe that Zaeem also has to add something. I'll switch over to him.
Yes, Dr.
Zaeem. Thank you, Dr. Fareeha. Well, I see a lot of people asking me a lot of questions about, so they say if we are positive and we have asked for another lab test, and people need to know one thing, that once you're positive is basically positive. Even if you are negative in the second test the same day, it still remains the positive. And people tend to have this idea from somewhere that once the lab tests them positive, they go to another lab and then come with the comparisons. Look, this lab has given me the negative test and this is giving me the positive one. So this is
Yeah.
one major information that I wanted to share, that if you're positive once, it means you're positive.
Amazing. I mean, a lot of people, they think if they are positive one day and they do test next day and they get a negative result and then they do the comparison. I think that's a very wrong comparison that we normally do. I think before we go to the audience and hear their question, Dr. Zaeem, I'm going to ask questions from you and everyone the same question. Share an interesting experience with us working during COVID, something very interesting.
Yeah, thank you. Before I go ahead with this, and I see you doing a lot of work yourself, and I would want to, on behalf of the panel, appreciate you as well, because you've been appreciating all of these people in the panel. And thank you for the services that you also give to the people that you work for. Initially, when we were back in, when the COVID started, the first case was in Islamabad. It was really interesting that, I mean, across the world, everybody was not really ready for the pandemic to, so we had the systems in place, but, since it was the beginning and we would fumble, we would like look at different things differently. So this one positive guy, he was, we have a mechanism to trace people. I wouldn't want to share what that basically is, but it was positive and he was running around and we were running after him. So we got him from like some remote area. He was not willing to give up, and he wanted to escape from the teams of COVID-19, but luckily they got him from somewhere which he could not even imagine. But these are the things that come like back and forth. And some of the times when somebody tries to break that, um, um, isolation or quarantine, uh, somehow, there are mechanisms that we can put in place to know. And some of them would like try to sneak out with the gadgets, and we call them and like, where are you going? So they're saying, no, we are home. They're like, no, you are not home. Okay, these things happen, and we had, different interesting stories, but I don't know if that's appropriate to discuss it here. But since we had good systems in place, we've been trying to, enjoy working at the same time. The threat of the COVID-19 and the fear that it might spread more has kept going. And thank you for
Amazing, amazing. I have an interesting story too, but before that, I really want to appreciate and thanks all the viewers who are with us on the Facebook, who are sending us the questions and sharing these videos to give a message to other people. So I was in Karachi 2 weeks back in a hotel, and early morning when I was running late for a meeting, I ran to the elevator and I forgot my mask in the room. And there was a couple in the elevator, and the husband was wearing mask when the wife wasn't wearing mask. So the husband took out a mask from his pocket, gave it to his wife, and told her, darling, do not behave like ignorant people who do not wear masks in public places. Please wear it. So it was like a slap on that time, but since then I've never left my mask in my room or in my vehicle. I always have a mask on me. It was a great experience. Dr. Fareeha, if you want to share an experience of your an interesting experience of your work during COVID.
Oh, I wouldn't call it interesting. We are a family of doctors. There are 5 doctors in the house. One of my brothers is working as an anesthetist, so he's exposed to COVID. He got COVID. He came home. He isolated himself. That was last week, and I wish that what Zaeem has in Islamabad, we would have in Lahore as well, because I reported that the next day to the department. I work for the department, by the way. That's a secret. That's an open secret. I work for Punjab Health Department. I'm still waiting to be tested, traced, and isolated. So it's up to me to stay home or go out and spread it in the world. So unfortunately, this is a kind of a bitter story, but I don't see an end to this pandemic, at least in Lahore and Punjab, if our lack of test, trace, and isolate is in this state. I didn't have anything interesting, but I had something personal to share, and I hope that this medium would tell people to please stay home when they have symptoms, rather than go out and, you know, spread the goodness in the rest of the world, so that people like us and our parents and our children do not get infected. That's all. So I have the symptoms right now. I blanked the screen just to blow my nose or sneeze off and on. So that's it. That's it. Thank you.
Yeah, sometimes small experiences that becomes very precious for us. I remember when Mike Pompeo, the U.S. Secretary of State, shared a tweet about our work. I was very happy, but I wasn't sure that it will give and bring that much impact with it. It enhances the people's trust on our work, and I had very few volunteers at the beginning, but after PUAN's recognition and everything, there were a lot of volunteers, and I made an amazing team after that recognition came our way. Dr. Kumari, do you want to share an interesting experience with us? Dr. Kumari, can you hear us?
Yeah, so nothing much interesting. Yeah, we had I had my own journey with the COVID, having literally mortalities in my family, and yeah, I would say I was lucky to be with my father when he had COVID. I was actually in Pakistan and he got the COVID, and I'm just glad that I was able to serve him and be at the home, and I was being a doctor, you don't realize how a COVID patient is doing at home. And that's where I realized I had to do everything from scratch. How do we monitor vitals? How do we give food to him? How do we manage not getting everybody else at home getting infected? I had my little kids there, my mom was there. So these are the little things that you realize when you have a COVID patient at home and you're just serving that person. So yeah, and before that we had I have had 3 mortalities in my family. So that was the test of me being there, and my father is also aged, so that was really testing myself, and it was very tough treating him. Yeah.
Yeah, I think this was a big challenge for a lot of frontline health workers, and I really want to salute their efforts. A lot of us, we could not see our parents for months because we were afraid that we will affect them. A lot of us could not see our children and our friends. A lot of us never got any vacation and worked late night, and a lot of frontline health workers, they face stress and anxiety. And this time was especially very difficult for them. I hope again that they get the recognition and the reward they really deserve. Dr. Zaeem, do you want to give any message to people regarding COVID? Anything that you want to tell our young people, our alumni, and all the viewers?
Yes, as COVID is going up again, I think a lot of myths that existed in the past, I would rather call some of the people who still consider it as a myth, ignorance, by the way. And I think that needs to go away, and that we need to take care of some of the protocols that will help us remain safe at the same time will help our elders to be at the safer, safer place, as well as they remain healthy. Because if you look at the mortality and then the statistics, you would see all the elderly have almost died. In anybody you'd ask, in your friends, your circles, your neighbors, you'll see uh, a particular age group dying out of, the COVID-19. It's about time for us to understand the gravity of COVID-19 and the consequences that it might bring for our ignorance. Just because we don't want to wear a mask, we don't want to believe it, uh, somebody else has to pay. And also the fact that they also need to get their elders registered and get vaccinated and follow the SOPs. COVID-19 is a threat, and that still exists here. Thank you.
Thank you, Dr. Zaeem. Dr. Fareeha, do you have a message for
It's exactly what Zaeem said so well. And Zaeem, I am such a fan. You've done such a wonderful job in Islamabad. So great work. We need that spirit, but we also need to take mercy on guys like Zaeem who are working day and night to protect us, healthcare workers and the public health officials who are, and that is a bit of a personal responsibility. If we are feeling sick, stay home. If we can't, we have to go out, wear masks. If we observe good respiratory hygiene, good hand hygiene, we can actually get results. We can have people live really by being a little less selfish and a little more selfless. I mean, wearing mask is not such a hardship. Try avoid crowded places. It's a personal responsibility thing. Public health needs public to be a part of the whole effort to beat this disease. And we've lived in a paralyzed situation. As you can see, he was busy on the phone, probably yelling at someone. So don't make guys like him yell, okay? Just wear your mask, wash your hands, stay home if you're not feeling well. Don't go to crowded places, okay? Be kind to us and be kind to yourself and your families. That's all. Thank you.
Okay, I think we have lost Dr. Jahangir. But just a couple of questions that were coming in, Dr. Fareeha and Dr. Zaeem. Some people might be concerned that their parents are probably have comorbids like hypertensive and diabetes. What do you guys suggest for vaccinating those people? Should they go for that, or do they have to take any precautions while vaccinating?
I think, Dr. Fareeha, would you want to answer, or should I?
I think you should do it, and I'll just chip in.
Okay, thank you. And I think this is a very important question that everybody else in the country asks, and one of the frequently asked. Look, if the data suggests that the vaccine is safe on multiple levels, minus some of the minor complications that could come up. But for elderly and with the comorbids and respiratory compromises and renal compromises should consult with their consultant. Doctor, I or Dr. Fareeha sitting here cannot really know the clinical condition of a person and make a comment, but generally that we have vaccinated almost like maybe 10,000 elderly or maybe 15,000 of them, and we have received no complications, even though they had comorbids and their physicians have advised them and they've been safe, and generally a vaccine is safer and there shouldn't be any problem. Dr. Fareeha.
Thank you, Zaeem. Thank you, Bhavita. Just a quick point that I would like to add. As the current vaccine that we have in the country right now is inactivated virus. So yes, immunocompromised people might do well to discuss vaccination situation with the doctors first, which means diabetics in general, but also, for example, people suffering from cancer who are going through chemotherapy. Inactivated virus usually is safe, but we take precautions in people who have a poor immunity and can have can get symptoms or may not even develop any immunity. So that's something that you need to discuss with your doctor. But general advice is yes, get vaccinated. And the same thing, I'm like a broken record. So please, please, please observe preventive measures. Protect your parents and protect other people's parents. Don't mingle, don't go out and have parties and then come home and give virus. You may not even feel the symptoms. You may give it to someone who has who is vulnerable to infection and is elderly and may get really, really sick. So just be kinder and selfless in that regard for your family and friends, and just wear masks and wash your hands. So that's it for my end. That's also the preventive measure that you need for your diabetic family members or hypertensive. You just do not let them catch it. So that's all from my end. Over to Bhavita.
Also, Dr. Fareeha, also, you see a lot of people not wearing a mask, and when you ask them, um, a lot of people look at the people wearing mask as somebody who gets scared of virus and something. Look, it's not about you not wearing a mask. It's about you not wearing a mask and putting so many people at risk. You might not be vulnerable out there. There are a lot of people who are vulnerable, and it's not just you. If you're not wearing it for yourself, wear it for other people, and that's one of the important things that I see. And when somebody is wearing a mask among so many people not wearing a mask, people laugh at them. So I mean, that's very, very. I mean, I have serious concerns about that, and I would want people to know that wearing a mask is not getting scared of anything, but being a responsible citizen and having a civic sense.
Right.
I think 15. Just a quick point, adding to what I know we are running out of time, that 15 months into the pandemic, it's a lot about personal responsibility. And if people cannot take it, then you know what, everyone suffers. So we have to pick up the mask and wear it and avoid crowded places and parties and, weddings and, looking pretty. Mask does not let me look pretty. So no, let's stop that. My life is precious, so is yours, and so are parents and children. Over to Bhavita. Thank you.
Yeah, I just wanted to add one more group of people who should, if they should be vaccinated or no, which is very important. So I'll add in women who are breastfeeding or lactating, women who are pregnant, and women who are trying to get pregnant. So these are very important questions from our society. Dr. Fareeha, what do you suggest for these three categories of women?
I've read the government issued guidance on that, and it prohibits pregnant women from getting vaccinated, although there is women were not included. Pregnant women and women who were trying to get pregnant were not included in the trials, but it was a trade-off. The trade-off was dying of COVID and, getting very sick and then losing the fetus as well, versus staying safe, staying alive. And getting vaccinated. So the recommendation that I've gone through from physicians, I am part of a big group of American physicians who we just discuss all these things together. And the idea is to just get vaccinated and be safe. First yourself and then the fetus. So get vaccinated. Breastfeeding even is not a contraindication. And trying to get pregnant is definitely not a contraindication. The only contraindication, there is literally no contraindication to vaccination except having a really poor immune response to the point that you could get COVID from inactive virus, and that's also hypothetical. So let's not prohibit people from getting vaccinated based on faulty data or false premise. So yeah, get vaccinated.
Yeah. Yeah. And then Dr. Zaeem, I would like to ask you if having a previous COVID infection, should you get vaccinated, or you have developed antibodies and you don't need it? That's a common myth in people too.
A lot of research says that, even if you are infected, you can get the get vaccinated, and there's no contraindication for that. And in our experience, we have vaccinated a lot of people who were previously, infected, and there's no harm in getting vaccinated, because it's just like the killed virus, and will help you like build immune system. And also the fact that even if there are chances that even after the vaccine you might get it, because it's much safer, because if out of 170 people are safe, then 30 people, or if 80 people are safe getting vaccinated, 20 people get saved anyways, because we call it like herd immunity. It's advisable. You can get vaccinated even if you had a COVID experience.
Right. So I think we are running out of time now, and we should conclude it. Let's have a quick one-liner for the vaccination program. Dr. Zaeem, what do you say?
Long live vaccination. That was the one-liner.
Yeah. Dr. Fareeha, what do you say? Just a message for our community.
Get vaccinated, please, and thank you.
Yeah. Thank you so much, PUAN, for giving us this opportunity. And I hope that we have tried our best to convince people in getting the vaccination whenever and wherever they can get. Thank you so much, PUAN. Thank you so much, USAFE and US Embassy. Thank you. We are just signing out now. Thank you.